Good morning, good afternoon, good evening, wherever you are at. This is Dr. Diane Sanchez, and I am going to go over managing employee benefits. The learning objectives is to define a benefit and identify 4 strategic benefit considerations, analyze the differences between employee benefits in the U.S. compared to those in other countries, distinguish between mandated and voluntary benefits, and list 3 examples of each. Discuss the trend in retirement plans and compare defined benefit and defined contribution plans. Explain the importance of managing the cost of health benefits and identify some methods of doing so. And describe the growth of financial, family-oriented, and time-off benefits and their importance to many employees. So what is benefits? It's indirect reward given to an employee or group of employees for organizational membership. And there are employer-provided benefits. The average is about 30 to 40% of the total payroll costs, and actually in union organizations or in utility industries, they can be over 70% of the payroll. And it absorbs social costs for health care and retirement. So benefits often include retirement plans, paid time off, health insurance, life and disability insurance, and many more. And benefits are not typically based on employee performance. Rather, they are provided to all employees who meet eligibility requirements. So by this figure 13.1, you can see that by total compensation, wages and salaries, legally required benefits, paid leaves, how much the private sector employers pay, and how much the state and local government employers pay. And so there is a wide disparity between the two. Benefits and HR strategy. Benefits approach adopted as part of total reward depends on many factors. Size of the organization, workforce competition, organizational life cycle, employee demographics, corporate strategic approach, employees' life stages. Benefits can be used to create and maintain a competitive advantage for the organization. While they represent a significant cost, benefits are an important factor in the employee commitment and retention. Attracting and retaining employees and increasing productivity are business objectives that can be enhanced through effective design of benefit programs. Surveys by Towers Watson show that over 70% of employees regard employee benefits as an important factor in their decision to join or remain with an organization. So I talked about recruiting and retention, improving organizational requirements. You've got to meet the legal requirements, and then the benefit strategy really needs to reinforce the company's philosophy of social and corporate citizenship. Benefits can influence employees' decisions about which employer to work for, look for another job, retirement age, and the tax-favored status of the benefits are terrific because most benefits are not taxed as income to employees except for maybe time off, paid time off. But some companies gross up to increase the net amount of what the employee receives to include the taxes owed on the amount. And this is done usually at the executive level, but some management positions. Global benefits differ greatly across the globe. The total hourly compensation can be higher. Retirement and health insurance plans are very different. The amount of paid leave and vacation in the European nations is quite large compared to the United States. Paid time off for childbirth and medical disability, paid sick leave policies, And in many countries, employers and employees are heavily taxed to pay into government funds. Multinational companies must determine how to compensate both host country nationals and expatriates so that all employees will feel that they are being treated fairly. And decisions about compensation impacts global attraction and retention of employees for international employers. Public sector benefits for those workers, they enjoy more benefits than in the private sector. If you belong to a union, it can be as a much higher rate than non-government workers. Their union contract includes free health care, traditional defined benefit pension plans, and they can be quite lucrative. So benefit management components, what do we have to look at when we have figured out our benefits strategy? Well, we need to have a benefits design, benefits administration, technology administration, benefit measurement, cost control efforts, and communication to our employees. And these are the decisions that we have to make in benefit design. What percentage of total rewards should be provided as benefits? What benefits do employees value? Standard versus flexible benefit choices, which employees should be covered, what is the budget for benefits, and internal versus external administration. Flexible benefits plans allows employees to select the benefits they prefer from groups of benefits established by the employer, and many employers have this, especially with the different generations in the workplace. We're finding that this is the best venue for us to roll out benefit plans. Changes faced when providing choices. Employees may choose an inappropriate benefit package that doesn't meet their lifestyle. Younger employees may decide not to participate in retirement plans, and that would impede their ability to retire. So, also, flexible benefit plans have adverse selection where only higher risk employees select and use certain benefits. So, for example, employees with young children are far more likely to enroll in orthodontia benefits plans that provide braces than are older employees. So, since insurance plans are based on a group rate, the premium rates might be higher because too few employees who do not need braces enroll in the plan. And again, this could be higher administrative costs for the organization. Part-time employees are most likely to receive paid time off and retirement benefits, are least likely to receive health and life insurance benefits, and domestic partner benefits. In states where gay marriage is legal, companies must treat same-sex partners in the same manner as traditional married couples. Same-sex domestic partners are entitled to coverage on company medical insurance plans, are to be recognized under retirement plans as a surviving spouse. Offering same-sex domestic partner benefits shows that your organization is compassionate, progressive, and respectful of all employees. It can be a competitive advantage in the search for talent. Older worker benefit needs are important to attract older workers are things like modified work schedules, part-time benefits, simplified seasonal travel and wellness programs, annual financial planning, counseling to help them with retirement, and then phased retirement programs allow employees to work part-time as they phase into retirement and withdraw some retirement funds at the same time. So this is a great way. A lot of hospitals are using the phased retirement program for doctors and nurses so that they're able to train the new nurses coming in with their wealth of knowledge and experience. Benefits administration and technology. Many of you have participated in open enrollment, a time when employees can change their participation level in various benefit plans and switch between benefit options. Outsourcing benefit administration, that is, third-party administrators. Many organizations must make coordinated efforts to administer benefit programs. The administration can be overwhelming, and companies decide that they need to outsource to a third-party administrator. And those are vendors that provide administrative services to the organization. Technology and employee self-service. Gosh, the internet has done some wonderful things for us. It helps us communicate benefits information. It conducts employee benefits surveys. It facilitates benefit administration. It decreases expenses. It increases positive communication. And it effectively connects people across many HR functions. Self-service technology allows employees to change their benefit choices, track their benefit balances, submit questions to the HR staff and external benefit providers, and this is frequently used benefit matrix. This is things that we measure in the benefits world. Benefit as a percentage of payroll, which I talked about. Benefit cost per FTE is another strong measure. Benefit cost by employee group is another great measure. Benefits administration costs. Healthcare costs by FTE. That's, awesome measurement. Retirement plan participation rate. Paid time off utilization, and tuition reimbursement. So how do we do benefits cost control? Well, we can either reduce or drop certain benefits. We can impose more cost sharing to our employees. We can sponsor wellness programs to encourage healthy living. We can change prescription drug programs to have higher deductibles or various tiers of prescription drug programs, Tier 1, Tier 2, and Tier 3. And then we can consolidate different benefit packages. Employers create a clear communication strategy by using a benefits website, social media. We communicate information about the value of the plans being offered, reasons changes have been made to the plans, and then the cost of the plans, the fundamental cost of the plans are important. Benefit statements are personal statements of benefits that translates benefits into dollar amounts, and these have become really, really popular because it gives employees a snapshot of the total compensation, including benefits, that they receive. So it helps employees to see the hidden paycheck, the value of their benefits. And these statements can be shared with family members to emphasize the true package of the reward provided by the employer. Types of benefits is cafeteria benefit plans. That's employees are given a budget and can purchase the bundle of benefits most important to them from the menu of options offered by employers. Figure 13.7 is a great chart. It highlights in blue what's legally required by law to provide benefits to our employees, and then the light green is voluntary benefits. So mandatory benefits, COBRA, HIPAA provision, the new Patient Protection Act, which we've been calling Obamacare, medical plans, Medicare, Social Security, those kinds of things, ADA and OPRA provisions I'll go over, military service leave, FMLA provisions, workers' compensation, and unemployment compensation are all requirements of the government and legally required benefits. So 13.8 is how the typical benefit dollar is spent. 29% of the dollar is spent on legally required benefits. 25% is paid time off, and 17% is retirement plans, and 29% is health insurance. So Social Security Act of 1935 provides old age, survivor, disability, and retirement benefits. And you'll see on page 436, if you look up your year of birth, anybody born after 1960, it's now 67 years old when you can start getting Social Security benefits. And federal payroll tax is 6.2% on both the employer and the employee. Medicare taxes, Medicare is the health insurance program for older Americans, age 65 and above, and that is taxed at 2.9%. Benefit payments are based on an employee's lifetime earnings, and it's administered by the Social Security Administration. I highly suggest that some of you go out there and get your Social Security statement if you have not. It's a very interesting statement, and it'll give you estimates when you're 65 or 67, whatever your retirement age is, and how much disability you would get or how much your survivor benefit would be. Workers' compensation, security benefits provided to a person who is injured on the job. Concepts that balance the rights of employers and employees under workers' compensation is no-fault insurance. That means injured workers receive benefits even if the accident was their fault. For example, if an employee violates the safety rules and fails to wear safety shoes and drops a heavy object on his foot causing a broken toe, his medical and disability expenses will still be paid by the employer's insurance coverage. Exclusive remedy is workers' compensation benefits are only benefits paid to the injured workers and may receive compensation for work-related injury. So most employers, I believe, go with the exclusive remedy. Let's talk about the three-legged stool of retirement income. First of all, it shows that it's Social Security, at least in the 1940s to 1980s, and then it was an employer-funded pension or defined benefit, which most pension plans have gone away, and then it's your retiree savings. Now, it's Social Security. Hopefully, we will have it when we retire, retiree savings, and employee-funded retirement plan, a defined contribution. Retirement plan concepts is vesting. You've got the right of employees to receive certain benefits from their pension plans. No pension rights accrue if they have not been employed long enough to be vested. A pension plan feature portability that allows employees to move their pension benefits from one employer to another. Once workers are vested, they can transfer their fund balances to other retirement plans. So what's a retirement plan? A retirement plan or retirement program established and funded by the employer and the employees. And there's three types. What we call a DB plan, a DC plan, and a cash balance plan. And the DB plan is a retirement program in which employees are promised a pension amount based on age and service. And 90% of public employers provide this benefit in the public sector. And more companies have stopped this defined benefit plan because they have an unfunded liability and therefore cannot meet its obligations. DC plan is a defined contribution plan or retirement plan in which the employer makes annual payment to an employee's pension account. And that you would think of as a 401k type of plan where there's a contribution made to it. Cash balance plan is a retirement program in which benefits are determined on the basis of accumulation of annual company contributions plus interest credited each year. So, comparison of a DB and a DC retirement plan. A DB plan typically funded at least in part by employer. Amount of benefit paid at retirement is predetermined. Investment risk is borne by the employer, and the benefit is guaranteed by the Pension Benefit Guarantee Corporation, the BBGC. And employers make payments to that annually. They pay about $50 per employee for that. Amount of contribution changes on the basis of actuarial assumptions, and that's how many DB plans got underfunded, is the actuarial assumptions were lower than what really has happened. Common in the public sector and unionized workforces. And this is where you see a lot of union employees strike, is because of the pension plan. Either the company wants to stop the pension plan or eliminate it totally. That's another reason why employees strike. And defined contribution, typically funded by employee and employer, if you think about your 401k, and that's basically what most companies have. Amount of benefit at retirement is determined on the basis of your investment performance. That is strictly an investment risk borne by the employee. The benefit is not guaranteed, and the amount of contribution is defined by the employee participation level and a company match. Very common in the private sector and non-union workforces. Profit sharing plans, these are common defined contribution plans, DC plans as I call it. Employee stock ownership, 401k, agreement in which a percentage of employees' pay is withheld and invested in a tax-deferred account. And then auto-enrollment. Auto-enrollment is employee contributions to a 401k are started automatically when the employee is eligible to join. Most companies set the initial contribution rate at 3% of the pay. So, legal requirements of retirement benefits. Everything is covered under Employment Retirement Security, or ERISA, ADEA, or OPRA, what we call Employee Retirement Income Security Act of 1974. Retirement benefits and age discrimination in 1986, and the Older Worker Benefit Protection Act, what we call OPRA, in 1990. Let me go back here and just highlight a little bit, is that in 1986, the Age Discrimination Employment Act was amended that most employees cannot be forced to retire at a specific age. In many employer pension plans, normal retirement was at the age at which employees can receive and retire with full benefits. Employers must decide whether individuals who continue to work past normal retirement, typically 65, are eligible for these benefit packages. And then when early retirement plans came out, that's when the Older Worker Protection Act was enacted. and it requires equal treatment for older workers in early retirement or severance situation. It also sets specific criteria that must be met if older workers are asked to sign waivers promising not to sue for age discrimination in exchange for severance benefits during layoffs. All right, 13.12 is the key provisions of the Affordable Care Act, typically known as Obamacare. It requires most individuals to maintain minimum essential coverage or pay a penalty. It requires companies with 50 or more employees who work at least 30 hours a week or more to provide health care coverage or pay a penalty. Although there has been legislation to bump that up to 40 hours a week, it has not happened thus far. Extends dependent coverage up to age 26, eliminates lifetime and unreasonable annual benefit limits, requires coverage, full coverage, no deductible for preventive services. And back to dependent coverage, if you remember, our old plans would only give dependent coverage to children or dependents who were going to college. Now it's up to age 26. Restricts insurance companies from setting rates based on an individual's health status or medical conditions or other health-related factors or pre-existing conditions, and creates state-run health care exchanges where insurance companies will offer competitive health plans. So, how can we control health care benefit costs? Well, we can increase deductibles and copays. We can institute high deductible plans. We can increase the employee's contribution, the money that they share in paying for that, using managed care, which is, monitoring and reducing medical costs through restrictions and managing the primary and preventive care using specific providers that charge lower prices or restrictions on certain kinds of treatment, and prices negotiated with hospitals and physicians. Limiting family coverage and excluding spouses. Approximately 20% of employers have adopted these restrictions, and more companies are planning to do so. Switching to consumer-driven health plans, in which the employer provides financial contributions to the employees to help cover their health-related expenses. The companies provide a fixed sum of money to employees and allow them to choose their medical coverage and insure from an online marketplace. The employee can buy up the benefit level by paying the additional cost beyond what the employer contributes. Over 20% of large employers offer the plans, and this trend is on the increase. And increasing wellness efforts, as I spoke about before, really educating employees about health care costs and how to reduce them, formal classes, really discussing preventative and wellness efforts in their daily lives. We talked about types of programs that attempt to reduce healthcare costs is managed care, approaches that monitor and reduce medical costs through restrictions. Spousal exclusions, which I talked about. Most companies have decided not to cover their spouses. Consumer-driven health plans provides employer financial contributions to employees to help cover their health-related expenses, which I discussed before, and it gives employees ownership of their health care dollars. Now let's talk about COBRA. COBRA, the Consolidated Omnibus Budget Reconciliation Act, requires that most employers with 20 or more full-time and or part-time employees offer extended health care coverage to certain groups of plan participants. So, the employee who voluntarily quits or is terminated, or reduction in hours, or becomes disabled, has an employee or spouse or dependent children as beneficiaries, they get 18 to 29 months, depending on what the situation is. If you have a qualifying event, that is a divorce or a death of an employee, you use Medicare now, or your dependent status stops, then you should be offered COBRA. Your spouse and dependent children can be offered these things, and it's usually up to 36 months. Typically, the individual is no longer employed by the organization and pays the full premium, and the employer usually charges up to 2% premium additionally. And so many employees who leave employment find that cost prohibitive and choose not to use COBRA. And now with the onset of Obamacare, they could probably go to the exchanges and see if they're eligible for a tax credit. Timeline for COBRA notification requirements. COBRA initial notice must be provided on date of hire. Employer to notify plan administrator. COBRA happens with a qualifying event notice. Qualified benefit has the right to elect COBRA coverage. Qualified benefit initial premium is due. The monthly COBRA premium grace period ends, and the employee qualified beneficiary notifies the plan administrator of a qualifying event, and then the continuation period ends. So like I said, notification deadlines within the 30 days after the employee first becomes enrolled in the group health care plan, you've got to give the COBRA notice. Within 30 days after the qualifying event, 14 days from the date of the plan administrator receives notification from the employee, 60 days from the date of COBRA notice, 45 days from the date of electing COBRA, 30 days after the first day of the month, 60 days, 18 months after a qualifying event of terminated employees, 29 months after qualifying event for disabled terminated employees, and 36 months after a qualifying event for spouse and dependent children plan participants. This is a highly complex law, and most companies outsource COBRA administration because of all the requirements that the law states. HIPAA, the Health Information Protection and Accountability Act, allows employees to switch their health insurance when they change employers, regardless of pre-existing conditions. Requires employers to provide privacy notice to employees, not disclose their health information without authorization. Common types of financial benefits that some companies provide are home buying assistance, purchase discounts, stock purchase plan, financial planning, discount club memberships like to the gym or to Costco. Those are kind of neat financial services. And on the left is obviously insurances, medical, dental, life, disability, long-term care, and legal services. And then you've got education assistance, which is terrific benefit for tuition reimbursement. I hope many of you are getting funded by your employer, pursuing your master's. Trade training, professional certification and licensing, and then learning materials. So, insurance benefits. Common types of insurance benefits, like I said, life insurance, usually 1.5 times an employee's annual salary. Disability provides continuing income protection for the employee who becomes disabled and is unable to work. Long-term care insurance allows employees to purchase insurance to cover cost of long-term health care in a nursing home or assisted living facility or at home. And then legal insurance pays a flat fee for fixed numbers of hours of legal assistance for each month. FMLA, Family Medical Leave Act, covers employers with 50 or more employees who live within 75 miles of a workplace. And employees who have worked at least 12 months and 1250 hours in the previous year qualify for FMLA. The provisions are that it's a maximum of 12 weeks of unpaid job-protected leave during any 12-month period for the following situations: childbirth and a newborn care within 1 year of birth, adoption or foster care placement of a child, caring for a spouse, child, or parent with a serious health condition. Serious health condition is a health condition requiring inpatient hospital, hospice, or residential medical care or continuing physician care. Now, military family members who must handle the affairs of military members called to active duty receive 26 weeks leave to care for a military service member injured while on active duty. The impact of FMLA is a significant percentage of employees have taken family medical leave, and it has really helped them in that transition. Employers have to cover the workload for employees on family leave, and it places significant demands on HR professionals to ensure compliance with the FMLA provisions. They are very, very strict provisions, and again, a lot of administration that goes into making sure that we comply with FMLA. Guidelines regarding FMLA administration: you've got to return to the same or equivalent job. You've got to continue health care benefits during the leave. Intermittent leave can be permitted. That's day at a time leave or even hour by hour leave. Requires use of paid and vacation and personal leave as long as that's covered in your handbook and you educate your employees that that's going to happen. FMLA leave runs concurrently with any other disability. No penalty under any attendance policy. So when you're on FMLA, you cannot negatively give them penalty points under your attendance policy. A 30-day notice from the employee is required when they are going to take FMLA leave, and then you can ask for a fitness for duty test upon return. So, family care benefits. These are terrific benefits that some companies provide. Adoption benefits, which I think is absolutely wonderful. It really does provide maternity and paternity benefits to employees who give birth or adopt children, and some companies even give financial support to individuals who have adoption. They provide adoption assistance to their benefit packages. A child care assistance or elder care assistance. You know, we've got to balance work and family responsibilities. It's a major challenge for many workers, especially our baby boomers who are the sandwich generation, taking care of their parents and their children. And employers provide these programs for several reasons, but they want their employees to stay with their company, and so child care and elder care benefits can produce significant savings by reducing employee absenteeism and turnover. Here's other paid time off benefits. Obviously, vacation and holiday pay. Some companies have combined vacation and holiday pay and all pay as PTO plans, which is kind of just a bucket for anything that you want to use: holidays, vacations, sick. Family and sick leave plans. Then we've got employer paid group benefits. That's typically things that the employee can purchase through payroll deductions, and they're called voluntary plans that can go from pet insurance to cancer coverage, to a supplemental life plan. And then, of course, leaves of absences for, education if you want, or more importantly, taking care of the family, or sick leave to take care of yourself. So, I hope you have found this webcast to be valuable. If you've got any questions, by all means, place it out on the discussion board. Thanks for attending.